school. And then to be a surgeon, you usually have to do between 5 to 7 years of training after you finish the medical school, even though you're a doctor, before you can go out and actually do surgery on somebody by yourself without somebody looking over you and teaching you.
Thank you. So while you were pursuing your career, what difficulties did you have to overcome?
Well, it's the usual. I would say the usual difficulties. I came along, interestingly, as I've told you, I've been in this 40 years. So I came along at a time in this country where there were not equal rights for everything legislatively, which means legally in some places in the country, in the South. And my family is originally from the South, so I went back and forth to visit family. Um, you were legally not allowed to do certain things. Okay, and this is back in the 50s and the 60s and before the 60s, 1964, the Civil Rights Act, and 65, the Voting Rights Act and Medicare. But before that, there were limitations on what you could do as an African American. So in those days, the limitations were legislated, which means it was legal for somebody to tell me that you can't go to medical school or you can't do this. There were not those opportunities. In fact, as I was coming along with the civil rights legislation, I began to be able to get opportunities that perhaps I would not have gotten 2 or 3 years before. And it was basically the luck of my coming along when I did. So the major obstacles were people not wanting me to pursue the profession I wanted to pursue. And so I had to basically say, well, I'm going to make it despite you, despite that you're not going to help me, despite that you're not going to encourage me, despite that you're not going to show me the way, which meant that if the mentor that I was assigned to in high school or college said, you can't do that, or I don't think that's a good career option for you, I had to find another mentor who would encourage me and tell me that I could do it and give me the information I needed to be successful going forward. And that's something that's very important, having a mentor who can give you the information you need to go forward. And I find in a lot of schools, people don't, even our counselors don't give us that information to help us be successful. So I was fortunate. I got some people that were interested in me, that saw that I had potential, and they helped me where others stood in my way. But I did not, for some reason, I don't know why, I did not follow the advice of those who were trying to stand in my way. And I rather followed the people that encouraged me.
Because of those difficulties, were there any other career choices you kind of had in mind, or were there any circumstances that you kind of thought to yourself that maybe this isn't the career choice for you?
I think that, and you can still hear me, right? Yeah, you were cutting in and out. But I think that once I settled on becoming a surgeon, that was it. I did not have a lot of other career choices. I was pretty much dedicated to the fact that I was going to be what I planned to be. Now, is that smart? Should you have other things that you possibly should consider? Well, there's a couple ways to argue it. It's always good to have alternatives in case your primary one does not work out. And in surgery, I always have alternatives. So I never go into a surgery saying, well, I'm going to do it this way, Because if there is a way that I can't do it this way, I have to have an alternative plan. So you always have to have an alternative plan. I didn't really have much of an alternative plan when I wanted to. I was basically stubborn and single-minded. But I don't necessarily think having an alternative plan is a bad idea.
What has motivated you to do what you do?
What has motivated me? I love what I do. I can't tell you. It's not for the money. It's not for any glory. It's not that people are always happy with me. I do it because I make people better. It gives me more immediate gratification to take somebody into surgery and fix them or help them, perhaps even help them save their life, than anything else related to what I do. So it's the immediacy of what I can do for somebody that makes me really love my profession. And that's not to say other doctors who give medications and wait for them to work and help people along the line don't get gratification. But the thrill of my job is being able to put you on the operating room table, put you to sleep. And when you wake up, you're going to be better and you're going to be on your road to recovery. That's what I enjoy about what I do.
Are there any memorable moments, either good or bad, that you would like to share with the students?
Memorable in regards to my profession, or how do you mean memorable? The most memorable moments that you have should always be in the birth of your kids. So I can honestly say those are my most memorable moments. Now, if you're talking about in regards to job, if you're talking about possible bad moments and good moments, unfortunately, in any profession, we have things that we do not succeed at and things that we do succeed at. The things that we might not, I've had people die trying to save them. That is a very tough thing when you have somebody that you take to the operating room trying to save their life and they die on the operating table or shortly after. It's very difficult to keep recovering from that. But unfortunately, that is a part of what you have to do. The old saying is that you have to get it back up on the horse. So we go through ups and downs, and I specifically go through ups and downs based on how my patients do. If my patients are all doing well, oh my, this is wonderful. If I have patients that are not doing well, or I can't figure out how to help them, or I've done all I can and they're not doing well, it's not great. I'd have to, it doesn't mean I stop. It doesn't mean I change my attitude. It doesn't mean that I don't try to continue to get the person right. It just means that sometimes we are not going to be successful. The times that we are successful, it's euphoric. And you're so happy both for the patient and you feel good about yourself.
How do you cope with the feelings you get when one of your patients don't make it?
I'm saying, say that one more time.
How do you cope with the feelings you have when one of your patients don't make it?
Yeah, that's a good question. And I think different doctors, different surgeons cope differently. I personally cope by, I consider what was done, what I did, and if there were ways I could have been better. And it's general in medicine and surgery that we look at situations, either good or bad, that may not have gone well, and we try to figure out maybe why they didn't go well, and if there's anything we can do in the future so that it can go better. So that's standard about what we do with everybody. We look at all our cases, and I am constantly going over, you know, things that may not go well and trying to figure out why they did. And there's sometimes a lot of reasons. Sometimes, especially in cases of death, especially in multiple trauma where somebody gets hit by a truck or something like that, there are things that are so injured in them that you're not going to be successful. It doesn't mean we always don't try. We always try. But sometimes your success is not that great in certain types of injuries or accidents. Same with cancers of the bone. Sometimes we have to cut out cancers of the bone, sometimes with amputations, sometimes with reconstructive procedures, but sometimes the cancer progresses despite what we do, despite the therapies, and people die. We always look at it, but sometimes there is nothing you can do. But you have to be, to some degree, introspective, which means you have to think about it. And unfortunately, you have to learn how to cope with your need to think about the things that go wrong, because you have to do it. It's not enough to just say, oh, that's just bad, let me move on. You got to think and see if there's something you could have done better, which is hard on you, but you have to develop that constitution to be able to do that.
Would you say your career is tough on you emotionally or physically, or both?
It can be tough on you in both ways. You know, emotionally, you are tied to your patients and you're tied to how well they do. You also get tied to families. One of the things that I did more of when I was perhaps a younger surgeon was because I was specially trained in children, I had to take care of children. So when you have to take care of children, it's not just with children, but when you have to take care of children, you've got the whole family unit to take care of as well. Everybody's upset when the child is either injured or has disease or a disorder that you have to fix. And you have to understand that it's not just the child, obviously, you're dealing with. The child is scared, but it's the family unit. You have to be able to tell grandma what you're going to do to make the child better, convince grandpa that surgery is the right thing and will make them better, convince the uncle who's in with the group that you have the child's best interest in mind and will help them, and that you're committed and that you're not going to just do a surgery and they'll never see you again, that you're going to be there as long as you need to be for that child to get better. So, you know, how you approach and how you cope with this is different for everybody. There are people that need to talk it out with colleagues, people that use meditation and prayer a lot. But if you do this work, you have to learn to cope with the stress of both the good and the bad that goes along with it.
Okay. How do you maintain good relationships with your patients?
Say it a little louder.
How do you maintain a good relationship with your patients?
Well, I think the way you maintain a good relationship with your patient is to be honest and treat them like you would treat your family, basically. And that doesn't mean I'm always kissing and loving on my family. Sometimes I have to tell them hard truth. I have to be honest with them. You know, if they messed up, they messed up. Or if you think that they should not have let their 10-year-old child ride an ATV in the desert and fall off the cliff, then you tell them that. You're honest, like I would tell my brother if he did that and let my nephew fall off a cliff in an ATV, that now would have consequences on him for the rest of his life. So I think if you treat people like your family, you're honest, you're sensitive to them as you would be to your family, and you tell them the truth, that's the best way to go about it.
So seeing that your workplace is kind of people oriented, is there any way you keep or you would recommend keeping a good relationship with your colleagues?
You're talking about my colleagues at work or my colleagues
Yeah,
in general? So I run
your
a
colleagues.
surgery department. I have 70 people in my department. Okay, so I keep in touch as much as I can with everybody. There are different types of surgeons in my department. You might have the general surgeons, the ear, nose, and throat surgeons, the ophthalmology surgeons, the anesthesiologists, the specific surgeons that do specific surgery like colorectal surgery or neurosurgery. So the way I keep in contact with everybody in my department is I have department meetings. Um, and at my department meetings, I allow people to speak freely and talk about what their concerns are, what they're doing, how they think they can practice better. So I allow generally the chiefs of all those different surgical services to report, and then I ask for questions from the whole faculty to determine if there's issues that we can address together that will help all of us or help individuals of us. So the way I connect is with meetings, and that's probably the best way. And I like to hear from people. Before the pandemic, we did it in person. Now we do it like this via Zoom, and we try to keep in touch and keep everybody going and keep everybody's problems in mind, and help solve what problems we can.
Okay. What advice would you give future surgeons?
What advice would I give to future surgeons?
Yeah.
Well, if they know they want to be surgeons, once again, like we said at the beginning, they're going to need a mentor or more than one mentor. A mentor is a wise advisor, wise and competent advisor who basically will stay with you and tell you what you need to do so you can be successful. And that's from day one, that's from in high school. And in fact, there is something that I tell all high school students that are interested in going into medicine. And I will tell you guys this now so that you know if there's any, come in, hold on. Yeah, I'm talking, yeah. So that you, if you decide that you want to go into medicine, can be more successful. And that one piece of advice is, as you go off to college, if you think you're going into medicine, you should never go in the pre-medical curriculum. That sounds odd, right? Why wouldn't you go in the pre-medical curriculum? Does anybody know? Nobody knows? Speak up, anybody who knows. All right, so the reason you don't go in the pre-medical curriculum is because the pre-medical curriculum is meant to eliminate 95% of you, which it does. So once you do bad initially and get a bad grade, medical school is so competitive that you can't recover. And it's a hard thing to think that you're 18 or 19 years old or 17 or 18 years old and going to medical school, going to college for the first time, And in your first set of classes, they give you bad enough grades that you can't get to be what you want to be. And that is not reflective on who you are. That's reflective on the system needed to decrease the number of people going into medicine. So if you take the courses that you need for medical school, but not in the pre-medicine curriculum, you'll do a much better job if you can space them out and have time to do a good job and get good grades. And if you do this, you have a exponentially greater chance of success and becoming a doctor.
Thank you so much for sharing your advice. So, as someone who wants to go into medicine, what majors would you recommend?
In college?
Yes, in college.
Okay. So in college, what you have to do is you need to look at what the pre-medicine requirements are for medical school, okay? So you have to take maybe 12 courses to 15 courses to get into medical school, okay? So you figure out, well, I'm going to take biology, organic or regular chemistry this semester, along with, sociology or something else. And then you figure out over 3 to 3.5 years how you can fit the prerequisite courses in. The other courses, you just take what you're interested in. So in college, because I was playing basketball, I didn't have a lot of time. Luckily, I realized I can't be in the pre-medicine curriculum because I was always traveling playing basketball. So I had to take the courses individually, and I went ahead and majored in political science because that's what I was interested in. So I took a lot of political science, sociology courses, as well as getting my prerequisites in. And so my degree was in political science. So you can do anything. You just have to look at the course of the 4 years, see when you need to have your medical prerequisites done, space them out, and then find something else that you're interested in and finish the courses for that. It's easily done if you do it the right way. And if you don't know how to do it yourself, you can ask somebody for help, but don't let them put you in the pre-medical curriculum.
Okay. What encourages you to give or help younger students get into the medical field?
We need good doctors coming along. The problem with the medical field for many years is there are not enough underrepresented minorities in the medical field. We had that problem with women too, but the number of women has progressed where unfortunately in 40 years, the number of underrepresented minorities has not increased at all. So there is an element of structural racism built into medical schools, which are preventing underrepresented minorities from becoming doctors. It's not what I say, the numbers say it. The percentage of the medical school student population should represent the percentages of people in the population, of the different ethnic groups in the population. They don't do it. That by itself points out that there is a structural problem with the system. And the fact that in 40 years, there's the same percentage of African American physicians, Latino physicians, as there were 40 years ago, despite everything that's been done, despite the protest march, the civil rights marches, the Civil Rights Act, the Voting Rights Act, we still have the same numbers means that there is a structural racial problem. So until we're able to really work through this thing, and this is just not in medicine, it's in a lot of different specialties or a lot of different types of professions, then we're not going to have a good country.
Is there any advice for those students who sadly are going to need to kind of break down those racial barriers either in college or in their workplace?
I'm sorry, didn't hear you. You cut out. I'm
So
sorry, say that one more time. You cut out.
is there any advice you have to those students who are sadly going to have to break down these racial barriers either in college or in the workplace?
Yeah, my advice is always, and it goes back to the same thing, mentoring. You find good people who have your interest in mind. Now, one of the things that's really important for you to understand, if you are an underrepresented minority, there are places who are more accommodating to you to try to make you do well, to give you opportunity. Okay? Traditionally, this has been, especially for African Americans, the HBCUs, just like the school right next to you. Okay? So who does the school right next to you, Charles R. Drew University of Medicine and Science, it tries to bring in more underrepresented minority students, Black and Latinx students, different gender type students. So because they're not getting into your traditional medical schools. All right. So when you look to go to some place, what you want to do is find the support you need to be successful. Now, I went to a Ivy League school. I went to two. I went to Brown. Actually, I've been to a bunch of them. But I went to Brown and I went to Columbia. Were the people there welcoming and accommodating me when I went? Not really. When I was at Brown playing basketball, I had to go to organic chemistry class because it was only in the afternoon when my basketball practice was. So I had to make a decision because the coach was mad at me every single day. But I would start my organic chemistry lab, and my partner, thank goodness, would make it run for me. I'd go to practice for an hour and a half, hour and 45 minutes. I'd come back before the lab was over because they were 5-hour labs. And then I would finish my lab that my partner, my student partner on the labs would help me out for. And I had to do this for more than one semester. So if you go someplace that is not as welcoming to you, you have to find people who will help you. And you can find that pretty much everywhere, but some places are more welcoming because they are more interested in your success. And that's why I mentioned the HBCUs, and that's why I mentioned CDU right next to your school.
In what ways have you seen the medical field change during your time?
We always make new advances in medicine. That comes because part of what you learn to do in medicine is not just take care of people, but you learn to study what you do and do research to produce better outcomes for patients. So not only as a doctor are you a clinician, you have to be someone who researches what you do, comes conclusions based on what you find with your research, change the way you practice, and then you have to educate people why your suggested changes based on your research are important so that people get better care. And that's why most medical schools are in universities, because we not only take care of people, we research what we do and we see if we can do it better. It's very important that you understand that concept, that you have to look at what you do, research it, not just anecdotally, but look at it, look at what you've done, look at it honestly, and see if that's a good way to do what you do. And then you publish it and you talk about it, so that if you have a good idea to make changes which will help people across the country, then you can do it. One of the things we do at Charles R. University is we do research in underserved communities. Traditionally, underserved communities, Black and brown communities, did not have research done on them. They were not treated with new medications to see how they would affect them or if they would work. New surgical procedures with new instrumentation and new implants or whatever we're using were not used in Black and brown communities. So it was always tried in more affluent communities. But we research what we can do in underserved communities to do better in terms of treatment.
So you've stressed that getting a mentor is truly important if you want to be successful. Can you describe how you went about getting a mentor?
So at different levels, you use different strategies, but mostly after you talk to people, you have to determine who you think has your best interest in mind. So if I'm in history class and it's a history professor, that has my best interest in mind, but I find that my biology teacher doesn't seem that interested in me, I'm going to ask my history teacher to mentor me, but then I'm going to ask him to see if he can connect me with somebody in biology or chemistry that would be a mentor for me. So you're going to go the way of least resistance. You're going to go to somebody that you trust will help you, and they will help you find the right people to further your career, help you along the way.
Okay. What do you want students to take away from this presentation?
Well, I want you to take away from it the things that I've told you. Mentors are important. Do not go into the pre-medical curriculum if you are interested in medicine. You do your best. You're going to have to work at it to succeed. Nobody's just going to get lucky and do it. So it's going to take hard work, but that if you do hard work, you concentrate, you listen to your mentors, and you have a goal, and everybody needs goals. So for you guys, all right, maybe your goal shouldn't be, well, I'm going to be a orthopedic surgeon. Maybe your goal should be, well, my ultimate goal is to be a doctor, but my 2-year goal is to get good grades in biochemistry and biology and physics in the next 2 years. And that's your 2-year plan that you're going to have as you go into college. And then you take the other 2 years and say, okay, I've done this and I've been successful. Now I'm going to have another 2-year plan. Okay, or a 3-year plan. And you plan out, when you have a plan, you plan out those steps that you can take so that you can be successful in your ultimate goal. And that's what I tell everyone. Keep planning. I plan even today. I plan for 2 years. I plan that I'm going to establish a surgical residency program That's a program to train young surgeons. And I have to plan out the steps to get there. Now, we don't always get to our goals, but if we don't plan, we almost never get to our goals.
So can you kind of describe what your plan was in college or your 2-year plans?
Yeah, my plan was simply this. My plan was I understood early that I was needed to get to medical school. So I had to schedule my courses in a way that I could take them. I had to make sure that I did not make um, every party on the campus. I had to make sure that I had friends who would set up the labs for me so that when I had to practice basketball, I could still get my credits in organic chemistry or one of the other labs that I had to take. So I had to plan this out. And then after the 2 years, I had another plan to get farther. And with my plans, things sort of fell into the way that they should be, and I became more and more successful because I had planned.
Okay, I would like to open it up to the students to ask any questions they have. So if you have
Sure.
any questions, can you please put them in the chat or just unmute yourselves?
But we'll still continue to ask you questions. So something that I'm really curious about was how COVID-19 kind of affected your job.
Well, COVID-19 affected everybody, okay? Um, a lot of physicians and people that worked with the people that developed COVID-19 contracted the illness. And I mean, I have a cousin who's a pediatrician who got COVID and died. So it affected us just like it affected most people. You were afraid, but we do what we do in life. We're trained to help people. The challenge is there. We have our moments of trepidation and fear, but we're trained to help people. So that's what we do. And it takes a long time of training to get to the point where you just do what you do to help people. You understand the risk, and the risk is real, but you understand the need, and the need is real. And so we do what we do because that's what we train to do, that's what we want to do, and we think that that's what we're meant to do.
Okay, there's a question in the chat saying, do you recall how many classes you took in the beginning of taking your college courses?
I took either 4 or 5 the first semester. I cannot remember, to be honest with you. It's kind of like a long time ago. So probably 4 or 5, maybe 2 of them were, or 3 of them were science courses, first semester. I didn't take 5 or 6 science courses, no.
Right. So I know if things were as they usually go, without COVID-19, you would be a supervisor for King Drew's program. Can you kind of explain what you would do with the students that you would receive from King Drew?
What I do with the students that come over from King Drew?
Yes.
Yeah, we have a program where they and you guys, I don't know if many of you guys have been in the program. The last year, obviously, we haven't had the program, but the students come over. The students that express interest in being in orthopedic surgery come with us. They have their white coats, and we involve them in coming with us in to see the patients. I give them information to look up, things that I want them to know. And each time they come up, we involve them in seeing other problems that we see when we take care of patients.
Okay, another person in the chat said, did you volunteer in any extracurricular or internships that helped you get closer to your career of a surgeon?
I'm sorry, say that one more time.
Did you volunteer in any extracurricular or internships that helped you get closer to your career of a surgeon?
Yes, I volunteered and shadowed surgeons. I also went to a couple of summer courses when I was in college that prepared people to go into medicine and strengthen their understanding of the basic sciences in medicine. But I shadowed people, and that's a good way to do it, or participated in clinics, just like you guys participate over here and shadow us over here to see what we do. Now, unfortunately, I'm going to have to leave because I still have patients waiting for me. They've been very gracious to me this morning by not complaining too much as I've taken this hour. But if there's any other burning question, ask it now because I'm going to have to leave you guys, even though I'd love to stay with you another 2 hours. Perhaps we can do it another time.
Thank you so much for your time, Dr. Washington. I think that's it for questions, but I'd just like to thank you. This was very nice. I love hearing from you. Thank you.
Great. Anytime, I'm across the street, especially if any of you are interested in surgery. I'm a good person to talk to.
Thank you, Dr. Washington. That was awesome. You made us miss being at school more and more. I think he's gone now, but outstanding. What a treat. Everyone, did they get the link?
I was just going to say, we're about to put the link in the chat and you need to complete the survey for us. Do either of you have that available?
I'm on my phone.
Poor thing.
Thigpen, do you have it available or I can go in and find it?
Oh, sure.